Can you tell us why you found this particular case a compelling case study on political priority for health issues?
It was an issue that was obscure, that no one paid attention to, and then rose to national prominence over the course of a decade. I think a second factor is the critical role of political champions within the system pushing this issue and generating attention for the issue. And thirdly, I think this case has a lot of lessons for other settings.
What was happening in Bangladesh when you arrived there?
Before 2000, you'll see a sharp decline in under 5 mortality, infant mortality. However, it was sort of hidden, the newborn deaths, the burden of newborn deaths within infant and under 5 mortality.
How did you get started?
So you see in Bangladesh there are lots of opportunities, lots of partners working together, large-scale programs running. Those were like good platforms to bring the hidden issues around newborn health into limelight.
How did you take advantage of these opportunities and stakeholders?
We tried to convene a group. We called that group Newborn Working Group.
So after Saving Newborn Lives at the global level hires Uzma to do a scoping report, then they need to find someone to lead the program. And they make the wise decision to hire her. Mm-hmm. And she emerges as the foremost, working quietly behind the scenes, as the foremost champion for this cause across the nation.
What were some of the things that made you effective in bringing together this working group?
I had to do some sort of desk work to find out who are the key players in the country who can or who already has some agenda around maternal, newborn, child health. And then I had to knock at those doors.
Having clear, credible evidence that a problem exists is one of the most consistent factors associated with the rise. And what you see Uzma and her colleagues in Bangladesh doing is translating this evidence and getting it into the hands of the right people and communicating it in ways that they understand, that appeal to their interests, that prompt them to act.
Has newborn health improved in Bangladesh?
We can now say that it improved, definitely. The data shows it improved. And the recent analysis of achieving the Millennium Development Goals says that Bangladesh is on track of achieving MDG, which is great. But if you ask me whether the work is done, no.
Is it a unique case, or could this happen elsewhere?
There are a lot of elements of this case that really are very applicable to many other countries. One is the role of political champions, such as Uzma and her colleagues, policy champions who take an issue and with passion and perseverance and attentiveness to the interests of other stakeholders involved, make the case and pursue this. Connected to that, the role of communities of champions or policy communities who link together and come to evidence-based consensus on what needs to be done. A third element, and I think a lesson from this case, is the critical role of credible evidence.